Dr. Andre Hattingh's dream was to be chief surgeon at a large hospital. But his outlook on life changed in 1994 when he volunteered to be part of a Red Cross team dispatched to Rwanda. He says he was among the frontline workers helping victims of the genocide and recalls the devastating impact on the children who suffered horrific injuries from machetes and pangas.
The problem was that I found there was nobody that stood up for those children, and there was nobody, and I must stress the nobody, that helped them. Nobody. Everybody just looked the other way. And then I made a promise that one day when my children are out of university, my house is paid, and very, very importantly, my wife agrees, guys, this is important, your wife must agree, then I will do something for the children.
Hattingh retired in 2016 and started Paediatric Care Africa. His multidisciplinary team, comprising of doctors, dentists and physiotherapists, run outreach programs in informal settlements and rural areas. They provide free consultations, medication and treatment. Their patients' progress is tracked every 3 months. Hattingh says they especially look out for undocumented cases of cerebral palsy.
And as you get bigger, they cannot lift you and carry you around, which means eventually you're going to stay where you are. So your family do go to town, they do go to church, they do eat in a dining room table, but you're not part of that. So what we can do is, if we can give you a buggy, it makes an enormous difference in that child's quality of life and the parents' quality of life. Now, can you imagine from looking at the world lying down and then suddenly looking into your eyes? I mean, what a wonderful thing for a child. And then, of course, they can sit with the parents at the table. The parents can push him to the neighbors when they go visiting. He becomes part of the family and part of the community, instead of just being somebody that is left in a room and that have to be attended to from time to time.
The NPO wants to expand their network of volunteer doctors, and the motorbike ride is a fundraiser for this purpose. They aim to sign up 2 doctors in every small town to examine 2 children free of charge in a year, with Paediatric Care Africa settling the bill for any treatment needed. He says this will enable them to almost double the number of children treated each year.
This is our 6th year that we're doing this. Just for interest sake, when I get to Appington this year, we would have circumvented the Earth once, the same distance. So what the idea is, we do the most northern, eastern, southern and western parts of South Africa, and by doing that, what we're doing in reality is we're making a circle around the children in South Africa to show them that we care about you if you live in the circle. And it's 7,000 kilometers, the total distance of the ride.
Hattingh says while South Africa has an extensive network of state clinics and hospitals, the harsh reality is that many poor parents in rural areas cannot even afford the taxi fare to access medical care for their children.
The mom doesn't have the money to actually take a taxi and drive 120 or 140 kilometers to a hospital. Should they get to the hospital, what happens quite often is the child is referred to a bigger hospital for surgery. Now, the problem what we have with the parents is they are poor. They cannot take the child, for example, from Mpumalanga to Johannesburg for surgery. In theory, it sounds fantastic. In practice, it's impossible. The mom doesn't have the funding to take the child there. And should they be able to take the child to the referral hospital, where exactly are they going to stay when they get there?
The generous doctor, who talks animatedly about his passion to help sick children, also makes time for lighter moments. His visits often include free motorbike rides and ice cream. He says it's a small gesture to inspire the little ones with excitement and hope despite their own circumstances. For SABC News, I'm Jayed Paulse in Durban.